Good morning. I'm BC Seniors Advocate Dan Levitt. Thank you for coming today. I'd like to acknowledge we're in the territory of the Lekwungen peoples, the Songhees, and Esquimalt First Nations. Today, I'm here to present the key findings and recommendations from our latest report, which details the challenges seniors and their families are facing accessing a long-term care bed in British Columbia, and the lack of supports available to them, and the gaps in communication while they're at home on the wait list, and the continuing increasing demand for care due over the next 10 years because of a rapid aging population and the need to invest more in seniors' care. So the background for this report, I want to start in Cranbrook in April of last year, where I had a town hall meeting as I toured the province when I first took over this role. And a woman told me about how long she had to wait for long-term care while her husband was on his dementia journey. After months of waiting, when she finally got the phone call that a bed was available, it was located an hour away in Fernie, over a mountain road. It was very difficult for her to continue to visit her husband. I thought this was a one-off story, and I continue to hear this story wherever I go around in the province, hearing about couples being separated and hearing about the frustration that caregivers and families who are calling our office are telling us about the long wait times for long-term care and the lack of information they hear about where they are on the wait list. There are more people on that wait list and people are waiting longer. Simply put, the supply of publicly subsidized long-term care beds has not kept pace with the growing number of seniors in our province. Since 2020, the government's plan is to build and replace over 5,000 publicly subsidized beds by 2030-31. The Ministry of Health has identified 16,000 new additional beds are needed to meet the demand by 2036. In 11 years from now. So here's the scope of our review. We looked at the wait times over the past 10 years. We looked at the wait times going forward based on the current Ministry of Health plan. We wanted to see how is this lack of investment impacting on the overall healthcare system? And what's the impact on family caregivers and the seniors who are waiting for that bed? We invited family caregivers to respond to a survey from our office, and 900 people answered the call and gave us their feedback from that survey. And these are people who either had placed a loved one recently or who are waiting for a long-term care bed. We also looked at the bed expansion plan to see, is it adequate? And we looked at different ways potentially of decreasing demand. So wait lists and wait times are on the rise. They're going in the wrong direction. Over the past decade, there's a 200% increase in the number of people on the wait list. 10 years ago, there were 2,300 people. Today, that number has increased to 7,200. That's a 200% increase. And the people on that wait list are waiting longer, an increase of 98%. For an average time on the wait list. Some people are waiting less, some people are waiting much longer. So we've gone in the past decade from 146 days, which is approximately 5 months, to 290 days, which is approximately 10 months. As you can see, the data is consistent, showing that we have a longer time to wait, but we have an opportunity now to address this issue. We can avoid the kind of crisis that we've seen with the doctors and with housing not being available. Two problems we also saw a decade coming in advance. Now, this slide shows the critical low bed supply. When we think about the number of beds, we look at a statistic to measure this by 1,000 people over 75 and how many long-term care beds there are. Well, a decade ago, there were 77 beds. Today, that number has decreased to 58 beds for every 1,000 people over the age of 75. That's a 24% decrease. Now, go ahead 10 years and look at, based on current rate of growth and the current number of beds that are going to be built, there will be 41 beds per 1,000 people over 75, a further decrease of 30% compared to today. The current government projections for population growth and the required supply of new long-term care beds will create exponential increases in wait times. So here's the real cost of the wait times. Well, it's going to put more pressure on the emergency departments. If you go to the hospital expecting to be seen in emergency, you're going to wait longer. It's going to affect everyone, not just the seniors waiting for those long-term care beds. And if a senior does go into emergency and gets seen and gets a bed, well, they'll be occupying a bed in that hospital, which will further delay and perhaps cancel some surgeries because they're waiting in a bed that would have been used for somebody recovering from surgery. And we're going to see more hallway medicine. And think about your doctor's office, how difficult it is now to get an appointment or to get a family physician. Well, a geriatric patient takes more time because of complexity and comorbidities than other people. Elder care does take more time, and the family doctors will be seeing those seniors that they would have seen in a long-term care home. And how are they going to get to the hospital? Well, they're going to be taking an ambulance service. More pressure on paramedics because of increased response times to wait for an ambulance. And it won't just impact the healthcare system, it's going to impact our economy and our jobs at times when we're really focusing on enhancing the economy. Well, if you think about it, who's the person who's providing care to that person while they're waiting for long-term care? It's often a spouse or a child, and it impacts on females more than males. So you're caring for your aging parent, you're going to miss work, you're no longer going to be able to work at a full-time job, which is going to impact our economy and our productivity as a province. And it's going to put financial stress on families. So instead of the government building long-term care, we're shifting that financial stress to families to pay for and fund a senior who's living at home who should be receiving 3.36 hours of care in long-term care provided by professional staff that have been trained to work with that geriatric population. Now you have a senior at home receiving inadequate care and a burden being placed on families because we have not invested enough in long-term care. So let's look at our targets. We're falling further behind as we go forward in our trajectory. So currently, there are just over 29,000 long-term care beds in the province. The Ministry of Health's own forecast is that today there should be over 31,000 long-term care beds. That's a gap currently of 2,000. Let's go forward 6 fiscal years to 2030-31. By then, if all the projects that are scheduled to be built are constructed, we'll have 32,500 beds. But the projection is that we almost have 40,000 beds by then. That will be the demand. That means there'll be a gap of 7,000 beds at that point, just 6 fiscal years from today. Let's go forward all the way to 2036. By then, there will still be 32,500 beds because the government has not made any plans to build beds past the next 6 fiscal years. By then, we'll be short the number of beds that we need, which will be almost 50,000. We'll be short close to 17,000 beds. So here's the story. We have to build 50% more long-term care beds than exist today to meet the demand. So here's the provincial government's bed expansion plan. Since 2020, the provincial government has announced 30 new long-term care projects for a total of 3,300 new publicly subsidized beds. To date, just over 10% of those beds have been built. At 380 new beds are built and operational. There are still 3,000 beds that must be built by 2030. And there's no plans, as I mentioned, to build any additional beds past 2030. We currently have a shortfall of 2,000, And the Ministry of Health's own predictions is that they need 16,000 beds by 2036, and with no plan to alleviate demand pressures to address the gap. So what can be done to ease the pressure? Well, one of the areas we have available to us is home support, publicly subsidized. Unfortunately, there's less available, despite investments in this area, there's less available for seniors who are receiving home support. And the caregivers tell us that it's difficult to access, and sometimes the appointments that are booked are not met. So it's unreliable to expect you're going to receive every appointment that is booked. And many people who require home support don't receive the 1 hour of care of home support per day. And the co-payment is a financial barrier. Ontario and Alberta do not charge a co-payment, and they have less people at a low care need in long-term care. So other things we could do to ease the pressure. Well, we could provide a day program, essentially during the daytime working hours. Unfortunately, this long-term care alternative during the day, it's not very publicized, and there's low awareness amongst caregivers, and there's lack of availability. Many seniors cannot access that service. Now, short-term long-term care is called respite care. This is overnight long-term care for days, perhaps up to a week. There's also low awareness amongst caregivers, and the number of respite beds is not going up, but as a percentage of the population is actually going down. Another thing we could do is build more publicly funded assisted living. 25 years ago, this program was introduced to provide essentially long-term care light. 1,200 people last year were waiting for assisted living. The wait lists continue to increase, and we have less beds today, less spaces in assisted living available for the population. We simply are not making enough investments in seniors and seniors care in the province, and that's putting more demand on long-term care. In our survey with the family members, we heard from caregivers, and the caregivers talk about the stress that is placed upon them while they're caring for an aging parent or a spouse who is on the trajectory to need long-term care. It's a burden on them. It's forced them to leave their jobs, and it's impacted on their physical and mental well-being. They need respite care. They need a break from this so they don't burn out if we're relying on them to care for their loved one for months on end. And many report this is the hardest job they've ever had and has a dramatic impact on their quality of life. What can we do to support families? Well, the first thing we could do is improve the support we provide to family members who are waiting for long-term care. It's often a siloed process where you're jumping from one silo to the next, and a navigator, somebody who could take you along the way and help you through that placement process, would be very helpful and provide some improved communication for families. Families tell us that there's not a transparency or accountability in the wait times targets that the Ministry of Health has established, and they often are told that they're on the wait list and told how long it could be, perhaps up to 2 years, but they don't get regular updates when they can expect to move in. We want to see better direct communication with families and seniors so they know where they are on the wait list and when they can expect to move into long-term care. And we have to improve more home support, adult day programs, and respite care, so people who require long-term care can get the care while they're at home. So we've made 6 recommendations in this report, and the first recommendation is that the Ministry of Health, along with the Ministry of Infrastructure, extend and update the long-term care bed plan. We want to see the beds capacity increase beyond 2030-31 to 2036. We must meet the growing demand for long-term care and reduce the wait times. Second recommendation is to improve community supports that could delay or even prevent long-term care admission. We want to see the financial barrier for home support being eliminated altogether. A senior earning approximately $30,000 a year in British Columbia approximately $3,000 a month, has to pay for 1 hour of home support over the course of a year, $10,000. Now their income has gone from approximately the 45th percentile down to below the 25th percentile. And now they're making a choice of, do I want home support, or what else can I forgo to make ends meet? And this financial cost is forcing some seniors to move into long-term care prematurely. We also want to see adult day programs being increased, more adult day programs available where seniors need them, and also more respite care, that overnight short-term, long-term care. The third recommendation is to strengthen the navigation supports that are available for long-term care. The system must be transparent and consistent for all seniors. You will hear some seniors complain that they don't understand why they're waiting for over a year for long-term care while somebody else got placed into long-term care after only a few weeks. We have to expand those essential supports while people are waiting for long-term care. We have to eliminate the copayment for long-term care, for home care, especially for people currently who are on the wait list for long-term care. And the fourth recommendation, the Ministry of Health, in collaboration with the Ministries of Housing and Infrastructure, develop a comprehensive plan to expand a broader range of publicly subsidized senior living options, such as seniors housing that's purpose-built for seniors. We want to see targeted investments in supportive housing, which is housing for seniors, providing housekeeping, laundry services, and meal services, and also more publicly subsidized assisted living, which provides essentially lighter long-term care. This will help seniors age in place in the communities where they live, providing them another option besides long-term care. The fifth recommendation we want to see is a review of the health authority waitlist management practices and clear wait time targets. This is something we want to see the government act on urgently, because we've done well with surgery wait lists in terms of hips and knees. When we set a benchmark, we know how we're doing. And if we implement that publicly monitoring wait time reporting system, we'll also do better planning for future long-term care. And the sixth recommendation is that the Ministry of Health develop a detailed action plan outlining how it will address the findings and recommendations of this report, including clear timelines and deliverables with annual updates. And we want to see this action plan submitted to my office, the Office of the BC Seniors Advocate, by October 1st, 2025, which is also the International Day of Older Persons. So why must we do this? Well, urgent action is needed. If we don't build more beds, it will affect all of British Columbians. Seniors will be living at risk in their home and will only get long-term care beds because there won't be enough when they're living at intolerable risk, when they're at a crisis. There'll be more seniors in emergency rooms. So if you're trying to see a doctor or get medical help in the emergency room, it will be much slower because a senior is there who could have been seen in a long-term care home. And there'll be more hallway medicine. And once a senior goes into emergency, they'll be occupying a hospital beds, which means that surgeries and other appointments that will be booked in acute care will be less available because the beds that you need to recover in won't be available because a senior in alternate level of care is occupying that bed. This will all put more pressure on the ambulance service, on paramedics, because how are seniors going to get to those places when they don't drive or their caregiver can't transport them? And if you think we're going to get more relief in the family physician offices, well, a senior in a long-term care home would be seeing their doctor in that care home. Now they're going to be going to the family physician offices more frequently, and there'll be less space available. And if you don't have a doctor, you'll be waiting longer as well. It'll also impact our economy because caregivers and their families expect to care for each other, and they will be leaving the workforce. There'll be more absenteeism, less full-time work, and less people available at a time when we need people to be supporting the economy. If we don't invest in long-term care, we will repeat the same kind of crisis that we saw with family doctors shortages and with the housing crisis. We must have a long-term care plan going forward. So if implemented, our recommendations will help ensure seniors and their families in British Columbia can access long-term care within a reasonable time frame and close to home. Seniors and their caregivers will also be better supported while they wait for long-term care with improved home support services, better access to adult day programs and respite care, and increased timely, clear communication about their position on the wait list. Additionally, seniors and loved ones will not need to access emergency rooms, family doctors, and hospitals as often because they will be receiving care in a long-term care home. That concludes the areas of the report I wanted to highlight today. Again, I encourage anyone who wants to read the report to go to our website, seniorsadvocatebc.ca. And if you don't have access to the internet, you can call our office directly for a printed copy. While the report's development was led by staff in my office, health authorities, Ministry of Health and Infrastructure, family caregivers, and others provided valuable information. Thank you to everyone who was involved in helping our office develop this report. I'd be happy now to take your questions.
A reminder to reporters on the line, please press *1 to enter the queue. You'll be limited to one question and one follow-up. We'll start in the room. If you could please raise your hand if you'd like to ask a question and let us know which outlet you're with.
Yeah, hi, can you hear me? Yeah, hi, good morning. Thank you for your report. Wolf Deppner, Canadian Press. I want to start with the headline figure, the 16,000 more beds by 2036. And I know it's not your job to tell government, well, you are telling government what to do, but you're not telling government how to pay for it. Can you talk about the cost of such an investment? Can you sort of estimate how much it will cost? And what would be the sources of revenue? What would you recommend? You asking government to develop a plan by October 1st. From where should this money come? What would be the most appropriate source of revenue for these 16,000 new beds? Thank you.
So the cost of building long-term care is something many of us talk about and look about. We're able to find money in the budget for many other infrastructure programs. And I think seniors who require long-term care, they deserve to have those beds available to them when they need them. I think we have to invest that money into long-term care. It's less expensive for someone to live at home than it is in long-term care. The capital costs are increasing dramatically, as we've seen with construction costs in many different sectors. And the cost of building long-term care is only going up. And we're hearing numbers that are north of $1 million per bed. And you can multiply it by the number of beds that need to be built. That's the current reality. But we find money for other things in the budget. We got to find money for this. I was encouraged finding out that, for example, in Cranbrook, the regional hospital district is providing 40% of the capital costs. So there are different ways of municipalities of different regions finding money and supporting the investment in long-term care, not just the provincial government.
Did you have a follow-up?
Yes, I do. So I heard $1 million per bed. That's the capital cost. What about the operational costs for those beds? And can you sort of also offer a figure in terms of the economic impact in terms of GDP? You talked about the cost of not having these beds in terms of the overall economy. What, if any, figures can you sort of attach to that cost? Thank you.
So the cost of operating long-term care bed is approximately $100,000 a year. So part of that is the capital cost if you're amortizing the mortgage. Part of it is the staffing costs and the support services, et cetera. That's the cost of operating long-term care. When you look at the economic cost for the reduced productivity because of caregivers are caring for that person, I think the main thing to think about is the individual family and the financial impact on them if they're losing an income or they have less money because you're caregiving. You're essentially shifting the government's responsibility to the individual. And I think it's something we have to have a close look at. That's why it's so important that we do the right thing and build long-term care beds.
Katie DeRosa from CBC. My apologies, this is a bit off topic, but we've just heard news that the integrated homicide team is taking over the investigation of the Menno Homes case in Abbotsford, where a senior or a care home resident was basically died and the death is being considered suspicious. Now homicide investigators are taking over this. Can you comment on just first of all what the residents must be going through in terms of the uncertainty and what you would say to people who might be just concerned and watching this case?
Thank you for the question, Katie. I don't want to comment directly on that case because it is a police investigation. I will say this, anytime there's a critical incident in a care home, it's very concerning for everyone who lives there, for the staff, for the family members, and for the whole community. There are processes and standards, there's regulations, and there is a process to investigate when a serious incident like that happens. It is unfortunate when you think about the population that is living together in close quarters, and unfortunately incidents do happen. There are standardized emergency response plans for different events. And I know that care homes, having spent 30 years working in them, they spend a great deal of time doing risk assessments and looking at what could go wrong and how to prevent it. And I think that what we need to do is to know that this is an isolated incident and that the general public is not at risk.
If this, as the investigation, after the police investigation, would this be something your office would investigate for any systemic issues, or is it something you think you might look into after the police investigation?
It's not something generally we would look at, but certainly if you think of just violence generally in long-term care, a number of years ago, there was always concern around somebody who has perhaps dementia or is, and their mind isn't working the way it used to. And things sometimes happen where you have somebody who is assaulted by another resident. And you hear about this, unfortunately, and that is when you mix people together who have cognitive impairments and who potentially aren't able to make decisions for themselves that most of us would make, things happen. But the care homes, they have a risk assessment they do. There are medical interventions they can do, and certainly we'll be looking at this issue and monitoring it. And again, I'm confident that the police investigation will work through the process and will have a result that will be shared with the public.
Hi, Kylie Stanton, Global News. I just want to go back to Wolf's point about the funding. You said $1 million, 16,000 beds. That's $16 billion in the next 10 years. Is my math correct? And if so, again, $16 billion is a massive investment. Where is that money going to come from? I haven't seen a project like that for as long as I can remember.
So when we look at the projects that the government prioritizes, infrastructure projects, we find money for many other things. We find them for hospitals, we find them for schools. We have to make the investments in long-term care. We don't have a choice really going forward. There are different sources of funding. Certainly the provincial government traditionally has basically managed the procurement process through the health authorities, and they've decided how much money and how many beds will roll out every year. But we have other funders that are available. For example, those hospital regional districts in Cranbrook, they funded and are funding 40% of the capital costs. And municipalities can also provide some reduction in some of the fees. And in other jurisdictions, the senior themselves will provide some equity who are living there. So there's many other options that are out there. Our focus of this report, the scope of this report, was really about the demand that's there and building enough beds to meet that demand going forward. And we simply don't have enough beds that are planned to meet the growing demand.
Just a follow-up. Right now, as it stands, sort of the current situation, would you agree that the difference between waiting for a bed at home or going to the hospital and getting right in, jumping the queue, so to speak, is that what is happening?
It's faster to go into long-term care from a hospital than it is to your home. We know that. Where there's a lot of pressure on hospitals for patient flow, to move people out as quickly as possible. So you are moving in faster from a hospital than you are from a home. We have those statistics, we monitor them, and it's unfortunate that's the case. Because when the program was introduced in 1978, it was heralded because it was done through primary care. And you were waitlisted, you moved in, you got to choose where you moved in, and it was a whole different environment. over the decades, we haven't invested enough. And because of that, now people are moving in either in crisis through the hospital or in crisis at home. And we have to build more beds so we can have a much better planned approach as we navigate long-term care.
And, just building on that question, how are these beds prioritized? You know, like how you know, is it just, you know, okay, you're on a list, and then if you go to the hospital, you get bumped up that list, but like how are these beds prioritized?
So for the individual, you're assessed based on your need, and you're also assessed on what your living environment is at home. So if you have a caregiver and you have those supports around you, and you're bringing in home care, maybe you're paying privately for some, and you have some that's publicly subsidized, then you may wait longer. But if you're at intolerable risk, for example, if you're living alone in an apartment and you no longer are able to answer your phone, no longer able to press a call button, that would be intolerable risk, and you're going to move up sooner and move in. Likewise, if you're in a hospital and you can't go back home because no one's there to care for you, you will move in faster. So there's a very complex but way that we assess seniors for long-term care, and we prioritize them based on the needs and based on the risk.
You kind of answered my second question, but you know, I was just wondering, you know, you talked a lot about strained families and caregivers, you know, adult children, you know, and spouses. Like, what happens to those individuals who don't have any family members? Like, it sounds like that they're bumped up the list, but obviously, you know, if you can still answer your phone, but you still might need some sort of care. Like, are those people just prioritized in general?
So somebody who needs care and doesn't have supports around them and who's at risk of self-harm or neglect, they will be more prioritized than somebody who has all the supports around them. So right now, really, the system is based on the lack of beds is based on caregivers, family caregivers taking on that service to their loved one. And I think when for spouses, when they got married, did they really think that they were going to be doing this in sickness and health? And now many are, because we haven't made the kind of investment that's needed. So we shifted the burden from government to the families.
Hi, Emily Joveski with Vista Radio. The report recommends setting benchmark wait times for long-term care like we have for certain surgeries. Do you have an idea of how long those benchmarks could be or would be appropriate for considering the wait list?
Well, if you go back and look at the number of beds that were around even 10 years ago, you think about there were 77 beds for every 1,000 seniors over the age of 75. And you look at how long people were waiting then, it was much less time than they're waiting now. So the key thing is we have to build long-term care to reduce the gap that's growing in the number of beds that are needed and the demand. So if we don't build enough beds, the wait list is only going to increase. So we want to see that decrease, because if we have a further gap than 2,000 beds compared to the number of people waiting that are in those beds, we're going to have longer wait times, and it's only going to put more pressure on family members and on healthcare system and reduce productivity in the economy.
And the review doesn't really it doesn't factor in elder abuse, but do you think that is something that should be more considered by the province as part of a more holistic way to address these issues and of long-term care?
So a few months ago, our office, along with some of our partners, we recognized Elder Abuse Awareness Day, and we wanted to make sure, and we continue to want to make sure that seniors and their families know who to call to get help. So if anyone is subject or is living somewhere that's unsafe, they can call Seniors First, and there's a community response networks and also our office to get the help that they need to get out of the situation they're in, because no senior should be living and experiencing elder abuse.
Next, we'll go to the phones. Mary Griffin from Check TV.
Hi, thanks so much for taking my call. I'm just calling, and forgive me if you've already addressed this, but I'm just trying to determine if you've heard about cuts to home care as a way for seniors, vulnerable members of the population within Island Health and other health regions as a way to maybe prioritize long-term care beds.
I haven't heard that, and it doesn't make sense, because if you're cutting a service like home support, that's already stressed and already strained because we've not added enough hours of home care for the population that is using that service, and at the same time we're not building enough long-term care beds. It doesn't logically make sense. So I can't imagine that they actually are reducing home support to put more pressure on long-term care. Both need to be invested in so we can support seniors to age in place. Most people, when you ask them would they want to move into long-term care, 80% want to live at home as long as possible. So the idea of reducing home support to encourage people to move into long-term care doesn't make any sense.
Did you have a follow-up, Mary?
Well, just wondering, we've received emails from viewers who are talking about home care visits that have been dramatically reduced from what they were initially proposed. And when they call the office to inquire, it's, well, there's staffing shortages. There's also an overtime ban. And I'm just wondering, because Island Health is experiencing job cuts at the moment, if the priority is reducing maybe administrative positions, overtime, and then seniors who are trying to live at home are those who perhaps are suffering.
Well, I think the overall picture is that cutting services to seniors for whatever reason is only going to put more stress on family members, going to put more stress on the healthcare system, going to prevent people from going to work because they're caring for their loved one, and is also going to only accentuate the problem we have right now where seniors are moving in to long-term care in crisis. So that troubles me to hear if that's happening, that there's a reduction in home support services. Certainly our office will be looking at that.
Next, we'll go to Mary Brooke from Island Social Trends.
Hi. Today you've clearly outlined that the long-term care supply is behind, and that also there should be a push for aging in place housing. So with tight budgets in the government, I'm just wondering which way should ministers decide to put their dollars toward more long-term care, or really make that shift to a housing supply for seniors, which really is kind of behind some of the Scandinavian countries who are doing that.
Well, thank you for the question. I think we have to do both. We're always going to need long-term care. Can we reduce that number of almost 50,000 long-term care beds? Perhaps we can by putting more supports into things like publicly subsidized assisted living. We haven't added beds since the program was first announced. We need to build more seniors housing where they can have supports where they live. And we need to certainly invest more in home care and overnight respite care and adult day programs. So we really need to see that whole continuum of care and services much more robust than it is today if we want to meet the growing demand from seniors for those services.
Did you have a follow-up, Mary?
Yeah, so there is a shortage of family doctors, we all know, and taking on seniors as patients is more of a load for doctors. So I'm just wondering what your recommendations would be to family doctors, particularly new ones coming into the system, whether they prioritize seniors, have a balance in their client base to take up some of the slack in seniors without doctors.
Well, I think it's important when we think about the most medically complex people in our population that they have the medical care they need when they need it and close to home. We know that if they don't go to their doctor's office, they're going to end up in emergency rooms and they may end up hospitalized. So when we think about complexity, whether it's somebody who's over 65 or under 65, we have to make sure that our family physicians are seeing them and providing them the care that they need.
Thanks, everybody. That concludes today's event.